Hello, everyone, and welcome. I'm Marcia Mott, and welcome to the UF Health Wellness University webinar. Thank you for joining us today as we discuss and answer questions about the COVID vaccine for women. I'd like to introduce you to our speakers today, Dr. John Smulian and Dr. Nicole Iovine. Dr. Smulian is the chair of the UF Health Department of Obstetrics and Gynecology. He's board certified in obstetrics and gynecology and maternal fetal medicine. Dr. Iovine is the chief epidemiology for UF Health, epidemiologist officer for UF Health. She's board certified in infectious diseases and internal medicine. If you have any questions for our speakers today, you can submit written questions at any time using the Q&A button at the bottom of your screen. At the end of the presentation, I'll read your question anonymously. I will only be accepting written questions today, including the ones that were submitted in advance. We're going to try to get through as many questions as we have. We have a limited time today, so we're going to do our very best. Dr. Smulian, I'm going to go ahead and turn it over to you now. Thank you so much.
Thank you very much, Marcia, for that introduction. And I want to thank Dr. Iovine for joining me today, as the two of us will hopefully try and address some questions that everybody has submitted, and for things you may not have thought of regarding the COVID-19 vaccine and pregnancy, as well as lactation and fertility related issues. And I want to thank everyone who submitted questions in advance. And as always, when questions are submitted, it makes all of us think and consider what we communicate and what we know. And so this has been this has not just been an important process for this presentation, but it's an important process to think about really where we are, what's the state of our knowledge and understanding of the COVID-19 vaccine as in related to reproductive health. So we're going to go forward, and I'm just going to ask for the next slide, since I'm not driving today. So next slide, please. So as a general outline for the discussion, we're going to start off with just a brief review of what we know about COVID-19 and pregnancy. Then we'll talk a little bit about the vaccine, and then vaccination in pregnancy, vaccination during lactation, and then we'll close with University of Florida recommendations. Hopefully during this process, we will address many of the questions that you have submitted. And please, as you heard, feel free to submit questions as we go along through the chat. So starting COVID-19 and pregnancy. So a couple of really important questions. One is, do pregnant persons get sicker if infected? Are pregnancy complications increased if infected? And are complications increased if moms get sicker? So this is one of many studies. This was actually produced by the CDC. And I just want to draw folks' attention to the last column here, where we look to see how much the risk is increased for specific complications if you get infected and you happen to be pregnant, compared to moms or individuals or women who are not pregnant. And so intensive care unit admissions are increased threefold. Needing a ventilator is increased almost threefold. Needing really highly technical oxygenation procedures beyond just a ventilator is increased about 2.5-fold, and their chance of death is actually nearly doubled. And in that the second column under pregnant, you can kind of see what the magnitude is. So 1 in 9 infected are symptomatic. Now these are just symptomatic, it's not asymptomatic, but 1 in 9 symptomatic women needed an ICU admission. Invasive ventilation was 1 in 34. The ECMO was 1 in 143, and death was 1 in 67. These are pretty impressive statistics. So next slide, please. So what about adverse outcomes related to COVID-19? And when you look at COVID positive versus COVID negative patients, this is just one recently published study from just about 2 weeks ago that came out that showed that pregnancy complications compare if you were COVID positive, and this is all comers, including asymptomatic women, there's really not much difference for stillbirth and infant death or preterm birth risk, maternal death or cesarean delivery rates, or blood clots even, just in all comers who tested positive who were pregnant compared to women who were negative. But it's pretty clear in the red down at the bottom that the chances of needing respiratory support or intensive care unit admissions are much higher if you happen to be pregnant. So next slide. And if you are pregnant, does the severity of the infection actually affect outcome? And the answer to that is yes. And this was a study of about 1,200 pregnant women, of which about half were asymptomatic. What they were able to show in this study is that 12% of these pregnant women had severe critical illness. And when that happened, there was a much higher chance of having a whole host of complications, including admission to the intensive care unit, need for a cesarean delivery, having a blood pressure hypertensive complication of pregnancy, a much higher chance of preterm birth. And most of these were because mom was sick. There was a 50% chance of the baby needing a neonatal intensive care unit admission. There was a small chance of pregnancy loss and a small chance of death, and about a 6% chance of a blood clot somewhere. So clearly, the more severe the condition, the more severe the infection, the more likely a complication. So in summary, do pregnant persons get sicker if infected? And the answer is yes. Are pregnancy complications increased if infected? Perhaps some, but this seems most related to severity. And clearly, are complications increased if sicker? And the answer to that clearly is yes. So next slide, please. And so let's talk a little bit about vaccination. And I'm going to turn it over here to Dr. Iovine.
Hello. Having a little trouble getting my video to work. There we go. Okay. Thank you so much, Dr. Smulian, and I'm very happy to be here. I am the hospital epidemiologist, as was mentioned. So my job is trying to keep everyone safe from infection. And vaccination is a huge part of that. So I wanted to just talk a little bit about exactly what the vaccines are. So right now, there's only two that are available in the United States. There's the one made by Moderna and the one made by Pfizer. You may have heard that a third vaccine made by Johnson & Johnson is on hold right now. So these are the only two that are available and the only two that are being offered in our area. Both of them require 2 shots to achieve the greater than 94% protection from getting infected with the virus. So the timing's a little different for them both. For Pfizer, you get your first shot, and if that's day 1, your second shot should be on day 21. And for Moderna, the second shot should be on day 28. However, the second doses of both of these can be delayed for up to 6 weeks after the first vaccination and still be effective. What's important to know is that when you talk about what a vaccine can do, it's not only about preventing people from getting infected. It also is very important to consider how it protects people from developing severe illness, hospitalization, or death. And both of these vaccines are highly protective, getting close to 100% protective in the studies that have been done in protecting against severe illness, hospitalization, and death. So these are really, really very powerful tools that are available to protect oneself from not just getting COVID, but from the really bad outcomes from COVID. And importantly, also, both Moderna and Pfizer are still very effective against the most commonly circulating COVID variants that we're hearing a lot about now, too. So for what's going around right now, these are still two vaccines that work. So let's just talk for a second just about how do these vaccines work. So it starts out with the understanding that we know that antibodies that are directed against a particular part of the virus, that's called the spike protein, those antibodies are protective. So this little cartoon here shows you the virus that's in red, and sticking out like spokes all over it is the spike protein. And if that spike protein attaches to our human cells via this receptor here, the result is infection. However, if you have antibodies in your body that are directed against the spike protein, the virus can never interact with our cells, so you end up being protected from infection. So the Pfizer and the Moderna vaccines contain only the genetic instruction, which is called messenger RNA or mRNA. It's just the instructions to make just a part of the spike protein. It's not even for the whole spike protein, it's just for a part of it. So it's kind of like if the virus were a house, the messenger RNA in the vaccine is the blueprint to make the house. But not even the whole house, just a part of it. Like just make the chimney part, for example. So it's also important to realize that messenger RNA is something that our bodies make all the time. This is the primary way that we make proteins in our body. So what happens is that we produce messenger RNA, and then our cells are able to turn that into the proteins that we need to live. So there's nothing unusual about messenger RNA in itself. It's in our bodies all the time. It's also important to realize, and I can't emphasize this enough, the vaccines do not contain the virus itself. It's just the instructions for part of the spike protein. So since the vaccines do not have the virus itself, you can get COVID from the vaccine. People will often have some level of reactions to the vaccine. So for example, many people will get a sore arm afterwards. And this is very much like what you would get after many vaccinations, like the flu shot. A lot of people will get a sore arm, for example. Some people, a smaller number of people, will feel unwell after getting the COVID vaccine. It usually only lasts a day, and again, can be similar to what you may feel after getting a flu shot. So some people will feel achy and very tired and fatigued. But again, these are symptoms that are short-lived. Another thing that's important to note is that the mRNA that's in the vaccine, it cannot persist in your body. Like I mentioned before, our bodies make messenger RNA all the time to make all the proteins in our body. So our cells have naturally occurring proteins that routinely degrade all messenger RNAs in our body, including the vaccine mRNA. So the mRNA will disappear from your body in short order. Also, the messenger RNA cannot interact with our DNA. It cannot do so chemically, and it cannot do so physically, because the messenger RNA is in a different part of our cells from our DNA. In this little cartoon here, the DNA is shown contained within the nucleus of the cell, which has a strong barrier all around it that prevents easy access for anything coming in or out. So the messenger RNA never has the chance to interact with our DNA. So therefore, the messenger RNA, it not only does it not persist in our bodies, but it can't interact with our DNA. So it cannot be passed on to future generations, and it can't affect our fertility either. So just to summarize here, the vaccine cannot make you sick with COVID-19. They don't have any live virus. You might get a sore arm or you might feel unwell after getting it. But again, these are short-lived and they don't happen to everyone. Also, getting the vaccine will not cause you to test positive for COVID-19 down the line. And that's because none of the current tests that we have for COVID look for virus fragments that will turn positive after vaccination. Now, there are some antibody tests that might become positive from the immunity that you develop after the vaccine, but we don't use antibody tests to determine if somebody is currently infected with COVID-19. The tests that we use would not be impacted by receiving the vaccine. Also, I want to stress that even if you've already had COVID-19, you should still get vaccinated. And it's not only that we're still learning about reinfections that occur, but as I mentioned to you, the vaccines give you a strong antibody response against the spike protein. And we know that the spike protein is when you block that, the virus cannot infect your cells. When you have a natural infection, your body makes antibodies against all parts of the virus. And while that sounds like it's a good thing, the truth is most of those antibodies do not protect you from reinfection or from infection to begin with. Most of those antibodies actually just don't protect you. So the vaccine is very beneficial because it gives you a very targeted, very strong antibody response against exactly the part of the virus that needs to be blocked to prevent infection. So that's why if you've already had COVID-19, you should still get the vaccine to make sure you have the best possible immune response. And again, I've tried to stress that the vaccine not only can prevent getting infected with the virus, but for those few people who do still contract the virus, it will very strongly protect you from getting sick with the vaccine, with the virus, sorry. And again, the COVID-19 vaccines cannot alter your DNA. They cannot interact with it at all. Remember that it's just the instructions to make a part of the spike protein, and it doesn't interact chemically or physically with the nucleus of the cell where the DNA is. The other two vaccines that are not yet available in the United States are of a different type. They are not yet available here, so we can hold off on discussing that for right now. Also, the vaccines, Moderna, Pfizer, they don't contain any controversial substances. They have all of the normal vaccine ingredients that many vaccines have. So for example, it has it's enveloped in these fats to protect the mRNA. It has some salts and a small amount of some sugars are there as well. But they were not developed using anything controversial like fetal tissues, and they don't have any other materials in them like tracking devices or implants or microchips. So they are, while the vaccines are new vaccines, they don't really have things in them that other vaccines haven't had in the past. So that's the end of my section. So I'm going to turn it back over to Dr. Smulian.
Thank you, Dr. Iovine. So just a few principles about vaccination in pregnancy and lactation, and this is just in general, perhaps beyond the COVID vaccine, but applies to all vaccinations. And number one, that antibodies will protect against infection, and that's a basic principle of all vaccines. The second, these antibodies, and these are primarily two classes of antibodies that are important for this protection, they can cross the placenta to the fetus and provide protection to a newborn infant to variable degrees. The second is these same antibodies, just like they can cross to the baby during the pregnancy, they can cross into the breast milk during lactation. and that antibodies in infants and breast milk provide protection to infants, and this is of variable degrees. And it's really important to remember that these protections are not expected to be perfect, just like protection from a vaccine is not expected to be perfect. We're very fortunate that the mRNA vaccines of Pfizer and Moderna are highly protective, beyond what we would, even our most optimistic hopes were, and we're very, very grateful for that. So next slide, please. So the vaccine's only been available since mid-December, and pregnancies that have been vaccinated, really, we only have information since that beginning of December. So as you might imagine, our ability to have information about outcomes in women in the first trimester who are vaccinated, we just don't have that information right now, other than immediate reactions to them or early potential complications. Women who are vaccinated later in the pregnancy towards their due date might have more information about pregnancy outcome, but they're relatively limited outcomes. And in fact, the oldest children that have been reported on after delivery from pregnancies who were that were vaccinated, those children are only about 10 weeks old. And so really those outcomes, we still have a lot to learn about them, and there is an awful lot of attention being paid to them. So here are two of the more relevant studies. Literally every day things are coming out. These studies here are probably about 4 weeks old, so they are truly fresh off the press. The first one looked at 131 vaccinated moms, and these were the mRNA vaccines, and 84 were pregnant, 31 were lactating, 16 were non-pregnant. The good news is that the antibody response was similar regardless of this that category. The antibody levels were higher than is usually observed from natural infection responses, which is really terrific. It tells us that in pregnancy and lactating women, that they have a robust immune response, that it's not exaggerated, but it is certainly very real and very, very good. So there was antibody detected in all of the cord blood samples from those babies, from the umbilical cord, and in all of the lactating individuals' breast milk samples. It was slightly lower than in the maternal serum. And there were no differences in the side effects, whether you got the vaccine in pregnancy, during lactation, or in a non-pregnant state in this relatively small group of individuals. So the second study was a smaller study, but they got into a lot more detail about measuring levels of these antibodies. And these were 27 vaccinated pregnant individuals, and these were the mRNA vaccines. And nearly all of them showed antibody responses, which is terrific. All infants had antibodies, but the one that didn't had a vaccine very close to the delivery date. And the new information that came out of this study was that antibody levels were similar between mothers and infants, suggesting good transfer of those antibodies. But the transfer to the infant was better if the vaccination was earlier in the pregnancy rather than closer to the delivery. And this graph here illustrates this. The line here is what you would expect to see if the levels were the same between moms and babies. And here, this 2 is the infant, the pregnancy was vaccinated 2 weeks before delivery, 4 weeks before delivery, 6 weeks, 8 weeks, 10 weeks, and 12 weeks before delivery. All along this, the mother's antibody levels paralleled those of the babies, but the overall antibody levels were much lower when you were closer to the delivery. And so the question comes up, when is the best time to be vaccinated during pregnancy? It looks like probably to allow sufficient antibody response to the baby, it's at least 3 weeks before delivery. But that's probably true that you need a couple of weeks after the second dose to get a robust antibody response in the mom, the most effective antibody response as well. So that's as much as we know from that aspect. Next slide, please. So there was another study that literally came out at the end of last week, and this was from Israel and looked at 84 moms who got vaccinated while lactating. And what they showed, and they measured the antibodies. Actually, this is IgA antibodies, not IgG, sorry about that, but measured them serially. And what they noted was that 2/3 had detectable antibodies at 2 weeks, over 85% had detectable antibodies at 4 weeks. And this was actually within 1 week after the second vaccine, and nearly all had detectable antibodies at 6 weeks. There were no adverse effects for those vaccinated or for their infants. And the graphs at the bottom just show that 3 weeks after the vaccination, 3 to 4 weeks, you saw a really robust jump in the antibody levels. Next slide, please. So what else do we know? There is something called the VSafe vaccine registry. This is a national registry that is a smartphone-based tool that collects voluntary data from individuals receiving the COVID-19 vaccine. And so this was implemented really early on in the vaccination process. And there are a lot of individuals who have entered information into this app. And this also, there's a subpart of this that includes a pregnancy registry that collects information on vaccination in the periconception period around the time you get pregnant or during pregnancy. And again, this is voluntary. It is not a sort of a mandated thing. So the information in it is what people put into it, but it's really pretty impressive what folks have put into it. Now, we are just beginning to see some data coming out of this. And so next slide, please. And so here's what we know so far from this, that so far there's over 3.8 million non-pregnant vaccinated individuals who have entered information into this VSafe vaccine registry. So that's a really large amount of information. And there's over 30,000 pregnancies that have information in this. And the vaccine, it's split pretty evenly between the Pfizer and the Moderna vaccines. So what we know about this between when we compare information between pregnant individuals and non-pregnant individuals is that there's no differences in the local reactions, such as pain, swelling, redness, and itching. So pregnant individuals respond the same with these as non-pregnant individuals. And the systemic reactions like fatigue, headache, the muscle aches, chills, nausea, fever, they also had no differences. So pregnant women are effectively, they react, they have the same side effect profile as non-pregnant women. So the pregnancy registry component of this has some outcomes of interest that include miscarriage, stillbirth, pregnancy complications, intensive care unit admissions, adverse birth outcomes, neonatal death, infant hospitalizations, and birth defects. Because we're still new in this process, we do not have really the ability to measure many of these outcomes the way we're eventually going to be able to do that. So as of the data that has been presented so far that's publicly available is that as of about 7 weeks ago, there were about 1,800 enrolled pregnancies at that point, even though there's about 30,000 now. So about 1,800 enrolled pregnancies, and there were 232 live births. And what they were able to show from those 232, the preliminary information is rates of miscarriage, stillbirth, gestational diabetes, high blood pressure complications of pregnancy, and problems with small babies. They were actually lower in the VSafe pregnancy registry compared to what we would expect in the general population. So there's no danger signals that we can tell right now that the vaccine has any effect on these outcomes. Next slide, please. So a couple of common COVID-19 vaccine questions related to pregnancy. Is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day? So the answer to that is yes. There is currently no evidence that COVID-19 vaccines cause problems with either becoming pregnant, that they cause infertility, that they interfere with the success of fertility treatments, or disrupt hormones. And I'm going to touch a little bit on the pregnancy-related issues in a moment, but there is some information on social media about potential changes in menstrual function in heavy periods or irregular periods after the vaccine. And right now, I would say that this is what we call anecdotal stories. There are people expressing their personal experiences. It has not yet been studied in any systematic way, and I'm sure that will be done, and we'll get information about that. But as of right now, there is no evidence that there's any meaningful disruption of hormones in the mom that has any kind of lasting effect after in non-pregnant individuals. I'm sure we're going to hear more about that in the future, but right now there's again, there's no danger signals that we've really been alerted to. There's also no evidence that the vaccines cause any problems with having a normal pregnancy or with the development of the placenta. Now, the initial studies of the Moderna and Pfizer vaccines deliberately excluded moms who were pregnant or individuals who were pregnant, but 23 women in the Pfizer study did get pregnant, and only one of them had a pregnancy loss, and that individual actually had received the placebo. So that limited experience, again, was reassuring. There's also some animal studies that have been reassuring as well. Next slide. So this is a really important issue that got into social media, and it has been really difficult to dislodge from social media. And that is, what about the stories online about the vaccine causing an immune reaction against pregnancy and fertility? Kind of getting at that question, if I get the vaccine, will that prevent me from getting pregnant? Will that interfere with a fertility treatment? And will it cause a problem with an existing pregnancy? Now, this whole issue started with what has been identified as a false report that came out of a single individual in Germany who actually used to work for Pfizer. And this report surfaced saying that there was a spike protein, that the spike protein on the coronavirus that you heard about from Dr. Iovine, that this spike protein was the same as another spike protein called syncytin-1 that's involved in the growth and attachment of the placenta during pregnancy. Now, there are many things that have spike proteins on them, but just because something is a spike protein on the surface of a cell doesn't mean it's the same thing. So the false report said that getting the vaccine would cause a woman's body to fight this different spike protein and affect fertility. In reality, and this is really important, the two spike proteins are completely different and they're distinct. And getting the vaccine will not affect the fertility of women who are seeking to become pregnant, including through in vitro fertilization methods. So just because there's an immune reaction to the spike protein on the virus that's specific to the virus does not translate into a reaction against other spike proteins. Extremely important because this has been a difficult issue to dislodge once it got into the social media and online space. Next slide, please. So the American Society of Reproductive Medicine, which is the professional society of those involved in dealing with assisting with fertility and treating infertility, they have come out with some very concrete statements. The vaccine should not affect fertility. Do not withhold vaccination from women planning to conceive or who are currently pregnant or lactating. Those having fertility treatment should receive the vaccine if they're eligible for it based on whatever state, local, or federal guidelines might be out there. Optimally, the vaccination should occur outside of a window of 3 days around the time of a fertility procedure. And this is not because it's thought to interfere with the procedure, but if there's a side effect from the vaccine, you don't want to confuse that with a side effect from a procedure. Also, if a woman is recognized as pregnant after receiving the first dose of a vaccine, then that individual should receive the second dose of the vaccine. And then if there is a fever, that should be treated with acetaminophen. Next slide, please. So some of the common questions: will the COVID-19 vaccine cause birth defects or change the DNA of a developing baby? I think you heard that we're not concerned about the DNA. We are really quite diligently looking at the issue of birth defects, particularly structural defects. Right now, certainly the animal studies have been very reassuring with this. The human studies, there have been really no danger signals related to ultrasound identifiable birth defects in ongoing pregnancies. We're still learning information about newborn babies. We certainly don't expect there to be anything, but this is going to be something that's going to be scrutinized quite a bit for many, many years. And there's actually a new study that is just been started that's enrolling 4,000 pregnant women with vaccination. That will be a prospective study that will go on for many, many years. Is there a best time during pregnancy to receive the vaccine? It's really unclear for some of the reasons that you've heard. We really don't know this with certainty. However, there's no restrictions on receiving the vaccine early or late in the pregnancy, but based on the information that I showed just a few slides ago, it looks like getting the vaccine at least 3 weeks before delivery is expected is probably better for providing some protection for an infant. Next slide, please. So just to summarize some of this information on vaccine lactation, vaccination and lactation, transfer of the antibodies occurs, but the impact is unclear. Duration of protection is unclear. Short-term effects are reassuring. Long-term effects are being studied. The amount of breast milk needed to maintain some protection is really unknown. It should not interfere with efficacy or how well other vaccine works that are given routinely. The CDC recommends not receiving other vaccines within 2 weeks of getting the COVID-19 vaccine. I can tell you that's not based on science. That's based on, maybe that's a reasonable idea, but it's not as, scientifically, it's not expected to interfere with its ability to work. There's no current data to suggest that the vaccine affects milk supply or milk duct clogging or infections of the breast called mastitis. And a really interesting question has come up of given post-vaccine breast milk that has these antibodies in it to older children will give some protection. And there is some thought that it's maybe possible that ingesting or drinking breast milk for young children may provide antibodies in the gut that might neutralize the virus if it's swallowed, but we know that COVID-19 is primarily a respiratory virus. And so its ability to protect is really unknown. I can tell you here at UF, there is some work being done to look at this. And there's also work being done on lactation. So that's more to come from here at our University of Florida family and researchers. But what I would say is there's not enough information yet to take that approach and use breast milk as a therapy for other individuals. And there's also the concern about compromising a breastfeeding child, a milk supply for an unknown or uncertain benefit for another individual. Next slide, please. So ACOG has our American College of Obstetrics and Gynecology has come out with a statement supported by the Society of Maternal Fetal Medicine, the FDA, and the CDC. And this is really kind of summarizes what this presentation has been leading up to. And that is the vaccine should not be withheld from pregnant individuals who otherwise meet criteria from vaccination. In some states, pregnancy has been designated a high risk group as a priority group. That is not the case in Florida, but certainly as vaccination is opened up here, pregnant women are eligible to get it. COVID vaccines should be offered to lactating women with the same criteria as non-lactating women. Conversations with clinicians may be helpful, but they're not required because we don't want to put barriers to access to women. And the safety data is still evolving, but really the information here we presented between Dr. Iovine and I before. So really the safety data is reassuring so far. Next slide, please. So to summarize all of this, we know that the risk of COVID-19 infection are significant for pregnancies and babies. We know that also that the infection can affect lactating individuals. So we know that the vaccine is expected to work in pregnant and lactating persons. We know that there is no current evidence of problems with fertility. There is no current evidence of increased complications for pregnancy with the vaccine. There's no current evidence of increased complications to the baby. There's early evidence that antibodies with potential protection cross to the baby, and there's early evidence that antibodies with potential protection cross to breast milk. So ongoing research to capture better information on pregnancy, lactation, and children will take many years. And a lot of people are paying attention to this, and we're looking forward to this information, but we're optimistic that the data we hear as we go forward will be reassuring and support the decisions we have made and the recommendations we've already made. So next slide, please. So what are our recommendations here at UF? Certainly pregnant healthcare workers should be offered the vaccine based on our prioritization guidelines. And pregnant healthcare workers here and all healthcare workers are eligible. So pregnant women are eligible. And pregnant women who are not healthcare workers should also be offered vaccines based on our prioritization guidelines. Lactating women should also be offered vaccination based on our current guidelines, which you certainly can get it. And women considering or actively pursuing pregnancy should be offered the vaccination, and we are currently doing that here in our department. So a couple of small points: pregnancy testing is not recommended prior to receiving the vaccine. If a pregnancy is identified after the first dose, get the second dose. And if you do have a pregnancy and receive the vaccine, then consider registering in the VSafe registry so that we can collect the information about this for future understanding of what happens. Next slide, please. And so these are common go-to resources from the CDC. Johns Hopkins has a nice website on this, ACOG does, and certainly I put this up for the MMWR, which is a publication that really has published a number of nice population-based studies on COVID. So I'm going to stop right there and open this up for, turn this back over to Marcia for continuing ongoing discussion.
All right, great. Thank you so much for that. I'm going to ask you to stop sharing your screen. And then Dr. Iovine, when you get a second, turn your mic back on. We've got a lot of questions. Thank you to everyone who submitted them in advance. That really helped us get prepared. So I think we answered a great number of those. So I'm going to just get through them really quick. If and you just touched upon this a little bit, but if a mother wants to get the vaccine after she gives birth, is there a suggested time frame of when this is best, or can they just do it right after they give birth?
So they can get it right after they give birth. There's a sort of a little bit of uncertainty about getting other vaccines within, and not getting the COVID vaccine within 2 weeks of getting other vaccines. There are a number of our postpartum moms on the floor that get a vaccine before discharge from the hospital, whether it's the pertussis, tetanus pertussis diphtheria vaccine, or the flu vaccine, or rubella vaccine. And the CDC in the past has recommended 2 weeks. I touched on that there's a little bit of uncertainty about whether that's a real thing or we've artificially created that barrier. But if there's no other vaccine, I would say you could get it any time. There's no barrier to doing that. And Dr. Iovine, I don't know if you have any other thoughts on that.
Yes, I would agree. And I would just say that, with all things COVID, we are constantly learning and evolving with our recommendations. But I would agree that, if you're not getting any other vaccinations, then by all means, get your COVID vaccination after birth.
We are also exploring, and I put this out there because this is a obvious question of, will we offer this to our moms after delivery before they leave the hospital? That would have been our ideal thing would be something like the J&J vaccine, where it's a one-time dose and there's no follow-up for a second vaccine. There's a whole level of logistics that's involved with bringing somebody back for a second dose. So everybody should be aware that this is an important conversation. We're having this conversation, and we don't want to start something we can't finish.
Okay, thank you for that answer. Someone asked, even though I'm fully vaccinated, my husband and I are still being very cautious with COVID-19 with social distancing and masks, because we also want to get pregnant. Should we become overly cautious when they do get pregnant? And have there been any vaccinated women who have then gotten pregnant and then developed COVID-19?
I can take the first part of that. I think that if you're being cautious now, you should continue to be cautious. That is a very wise thing to do. But I would also say that you're doing everything that you can to protect yourself from getting COVID. You've gotten your vaccines. From your question, I would say that you're probably wearing your mask still and your social distancing. Those are all excellent tools, and you should continue them. I don't want you to feel, though, that you have to become a hermit and shun all society, though, because, again, those things that you have done are very, very strong protections. And I would encourage you to live your life as normally as you can while keeping those safeguards in place.
And I would echo that. and just be reassuring that you have done everything you know how to do to protect yourself going into a pregnancy, and you should feel comfortable with that. The second half of that question about pregnancies that have happened after vaccination, and whether there have been escape infections, if you will, from that. I have not seen any reports of that yet, and we're just going to have to wait and see. The symptomatic infection rates are actually quite low after vaccination, and we know that from the millions of people who have received full vaccination. And so we're generally not testing people anymore unless they're symptomatic. And so I just don't think we've had that experience. We are still testing our moms who are admitted for delivery to the hospital, even though they've been vaccinated. And we have not had any of those here in our personal experience at University of Florida test positive who have received the vaccination, but our experience is actually quite small.
Okay. We had another good question that came in. I know you talked about women and issues with regard to fertility, but have there been any reports or studies about men and any implications to fertility on their side?
I have not seen any studies that addresses that specific question, but I would go back to what I said earlier, that we talk about biologic plausibility, and so there is at this time there's no way that we can see how the mRNA vaccine would affect fertility of men or women. Like I said, and Dr. Smulian said, they cannot interact with our DNA, they cannot be passed on, and the messenger RNA is degraded entirely by our bodies as part of the normal processes.
Okay, thank you so much. Is there any information or data about if a COVID positive mother who's breastfeeding will pass on antibodies to her infant?
So I think some of the information that we shared before shows that those antibodies are present in the breast milk. The degree of transfer solely from the breast milk to those infants, that data is not there yet. We expect there to be transfer just like any other vaccine, and in many of the studies, though, the protection does last as long as there's sufficient breastfeeding activity. And I can tell you that the lactation, the science within lactation for antibody protection is general information and may not be as specific to be able to answer that question with how much and for how long that protection is. Okay. We know that antibodies that cross the placenta from vaccination and pregnancy seem to confer some degree of protection against infections in general for maybe 4 to 6 months.
Okay. Is there any possibility of the infant having an adverse reaction like aches or pains or anything like that if the mom gets the vaccine while she's breastfeeding?
I would say that, and Dr. Smulian, I would appreciate your insight as well, that antibodies are passed on to infants through breastfeeding all the time, and that is not observed that the children become ill from receiving vaccines through breast milk.
Okay.
So I would not expect that to occur.
Yes, I agree. Yeah.
Someone asked a question, how long is it thought that the mRNA is present in the body after vaccination? And here's why they ask. I would like to pump and dump until I feel that my milk will only contain antibodies, but nothing from the vaccine ingredients.
So the messenger RNA will be degraded from your body. And that's part of the reason why you need to get 2 shots of it, because it just doesn't stick around very long. So I am not aware of studies looking at how long that process takes. But I would anticipate that the messenger RNA would be gone within a few weeks. I would also, and I'm not sure, Dr. Smulian, if you're aware of any studies. I'm not aware of any studies to see if the messenger RNA turns up in breast milk, but it's hard for me to think of how that could occur biologically. Again, messenger RNA, and I didn't mention this, but messenger RNA is actually a rather fragile molecule. It is not a hardy molecule. DNA is a hardy molecule, but RNA is not. It's actually very fragile. When you work in the laboratory with RNA, the thing that happens all the time is that the RNA degrades and it disappears. It's a very fragile molecule, actually. So for those two reasons, I would not anticipate that that the messenger RNA would get into breast milk. And as far as it being in your body, I can't. Again, I'm not aware of any studies looking at how long it persists. But again, it's not going to be more than a few weeks.
Okay.
I would guess that it's actually degraded sooner, but as Dr. Iovine said, the data is not there yet. And I don't think any of the recommendations suggest there's a need to discard breast milk. And in fact, we know that colostrum, the newest breast milk, is among the most nutritious of the breast milk. And so I wouldn't compromise that, certainly based on what we know. And sort of the as Dr. Iovine said, just thinking about the science and the biologic likelihood of it causing a problem, I think is extraordinarily low.
Okay. Someone asked, I'm breastfeeding and I got my vaccine. How could I specify that on the VSafe app? And also you mentioned if you were pregnant as well. So is that something
I don't
does, or do their physician do that?
No, it's patient entered. So individual entered. I have actually not personally been on that app. And so I don't know what it actually looks like. So I'm guessing.
I can try to research it. And then when I send out the recording in a few days, I'll send out the information about that. If anybody needs to register, put that information there.
Super.
Search that. Okay. All right. What about the IgG antibodies in the breast milk? Does that protect differently or longer than IgA?
I don't know to answer that specifically. Dr. Iovine, do you?
Well, the way antibodies work in general is, that they bind to the target, and in this case, the spike protein. So in both cases, that would be the expectation. That's what they would do. What happens after that is that this complex of the virus and the antibody are cleared by our bodies then. And the way they are cleared is a little different depending on whether it's an IgG or an IgA. But it really, it all ends up being the same thing, and that the virus gets degraded. So different cells of our immune system might be involved in clearing complexes with IgA versus IgG. But they all basically end up in the trash can, as it were. So, all those complexes end up being discarded and degraded by our bodies.
Perhaps the way I might think of that is that you can't really be an overachiever with one antibody versus another antibody. It's the immune response that is extremely important, and it's really difficult to separate those things out. And the effect is really what we want.
Okay. If you tested positive for COVID, how long do you have to wait before getting your first COVID vaccine?
Oh, okay. That's a great question. Yes. So the recommendation is that you wait until you are fully recovered, that you're feeling well, that you don't have a fever anymore. And at that point, then you can get your COVID vaccine. Some people will test positive for COVID and never not be sick at all. They may have tested because they were exposed, for example, but they are feeling well. So again, the guidance is that once you are feeling well and you no longer have a fever, that then you can get your COVID vaccine.
Okay, and then this might be our last question because I know we got to wrap it up, but is it better to get vaccinated? Is it better to get vaccinated pre-pregnancy if you're planning on becoming pregnant, or is it better to wait when you're pregnant so those immunities can transfer on?
I have to say, all of these questions are wonderful. My response to that would be, I would not wait to get vaccinated. That the prevalence of the virus in our community is still high enough that it does present a threat to us and a danger. And so I would proceed with that and not try and be so precise in timing something regarding pregnancy, because we know that the antibodies from the vaccine, at least up until this point, appear to be robustly persistent, and they should have the effect during pregnancy. Whether we're going to get booster shots in the future, I think that's a story that needs to be told. We're a ways from figuring that one out, but I personally would not recommend waiting till you're pregnant to get the vaccine. Again, great question. I'm sure we're going to have more information on that in the years to come, but certainly within the next year, that's going to be one that's a little bit unresolved, I think.
And I want to squeeze one more in because I really do think it's important to ask this one. I got a couple of things related to this one. So someone said they received the J&J vaccine, but because the others are more effective, they really kind of want to get those now as well. So is that recommended that they get the Pfizer, the Moderna, if they've already had the J&J?
That's not recommended at this time. That may change. So we pretty much really should need to wait and see on that. I would let people know, though, that the Johnson & Johnson vaccine, that the stated efficacy, the vaccine efficacy, was somewhere in the 70s for that vaccine. But vaccine efficacy just means that it prevented a person from getting infected or having a positive test with it. Remember, you can be infected and have no symptoms. What vaccine efficacy doesn't tell you anything about is whether people got severely ill, whether they were hospitalized, or whether they died. Other studies have shown that the Johnson & Johnson vaccine is highly effective in preventing hospitalization, severe disease, and death. So there may not actually be a need necessarily to get another vaccine after Johnson & Johnson. But again, like many things with COVID, this is unresolved. And it might happen down the line that recommendation would be made. But at this point in time, that recommendation does not exist.
I would also just add that the technology to develop the J&J vaccine is one that, for a variety of reasons, also is thought to be something to be safe to administer during pregnancy. And all of the conversations we had before about affecting the DNA, affecting cell structures, affecting birth defects, that does not have a different answer for the J&J vaccine.
Okay. Well, I thank you both so much for your time today. And I thank you so much for all the people who joined us as well. We're going to be sending out a link with the recording here in the next day or two. And I really appreciate your time today. Thank you so much.
Thank you.
Thanks, everyone.